And in other health news, one of the driving factors behind America's escalating health care costs is its aging population. Researchers finding that the cost for stroke treatments is expected to double by 2030 because of this demographic shift. The study conducted by the American Heart Association and the American Stroke Association also predicting an increase in strokes among people aged 45 to 65 over the next 2 decades. They say stroke treatment is so expensive because it usually involves care for long-term disabilities. One expert says the most important thing you can do is get yourself to a hospital as quickly as possible.
So a stroke, I always say to my patients that a stroke can present in any way, because a stroke really is because there's injury to the brain. And so because there's injury to the brain, it can present in any manner. But there are 5 major symptoms that the overwhelming majority of stroke patients will have. And I always tend to tell my patients that they should start with the top of their head, just to make it easy for them to remember. A very severe headache, not the usual kind of headache that you have, but a splitting headache, the worst headache of your life. Visual problems, double vision or blurry vision. Speaking difficulties, you can't comprehend, you can't speak, or your speech is slurred. Numbness or weakness on just one side of the body. And then finally, unsteadiness of gait or lightheadedness. If those things happen very, very suddenly, in fact, we call it like a bolt out of the blue, that could mean that the person's having a stroke and should call 911 and get to the hospital immediately.
The researchers also report that much of these costs should be covered by the Affordable Health Care Act, President Obama's health care reform legislation. The study claiming that the expansion of health insurance coverage and the focus on preventative care and wellness should offset the rising costs.